Thanks very much for inviting me. Thanks for the introduction. And I think, you know, what you outline your company's ambitions are, I think dovetails very nicely with dare say what I'm going to present, because I think what we've been learning over the last sort of 2 or 3 decades about Alzheimer's disease is really ripe, if you like, to, I think, really transform clinical care and clinical practice. And one of the key parts of that, as this title slide alludes to, is early detection. So, exactly, and I know we're over time, but I think one of the things is that, for instance, you know, I think you're right. I think if you have a biological measure like your blood pressure, you go on an antihypertensive, and you come back later and your doctor does your blood pressure, or the nurse does the blood pressure, and it's down. That's a surrogate marker for the risk of stroke and the risk of heart disease being reduced. Now, if you come back after 5 years and your PET amyloid or your blood-based amyloid is lower, or you've got better connectivity on some MRI measure, these are the things, not over the short time course, but over the long time course, saying that we think that intervention's made a difference. Now, there is evidence, and you know, we did a literature review on the Mediterranean diet and hippocampal volumes. There is an association with better hippocampal volumes and, you know, compliance with the Mediterranean diet. The timescale for these things is going to be very, very long, though, and that's why I think you have to keep these people engaged in your service. It's not a one-off diagnostic factory. It's a service that you work on. You're on the journey with the patient for dare I say, many years.